how do you like explain that to a patient that's like, oh, it seems so simple, but how can it help
Well,
me?
I think one of the things that I've come across is there's a fundamental difference, but also it's the same thing. All right.
Yes, I know.
But to me, you've got ideas about rehab,
Yes.
rehabilitation of an injured structure in the body.
Yes.
Which may include things like fundamental movement patterns, right? So, I mean, like if a person is having trouble getting out of their car, looking at like what structures do they need fundamental movement pattern training to help them, get back from a negative number to baseline, right?
Yeah.
Similar to that is like prehab, which I think starts getting into a different realm of what I think of as optimization, right? So like, for instance, if you have a person who's essentially going to recover fully from their injury, realistically, whether they see you or not, right? But they're maybe an athlete, or they're a person who at least has like a kind of fundamental minimum requirement that they want to achieve, but they feel like they can't get to yet. That's where I start looking at slightly more advanced ideas of how to escalate their training rather than just bring them back to baseline. And then finally, you've got, kind of full on athletic sort of optimization where it's like you have a sports specific training model, or you're trying to build some fundamental movement patterns into a person that will just enhance their athletic performance.